If you're watching this, chances are you're worried about your breast milk supply. But did you know only about 5% of women actually have a low supply? Yet nearly half of mums who stop breastfeeding early do so because they think they're not making enough milk. If you haven't been to my channel before, welcome. I'm Katie, a mum of two and parenting and breastfeeding coach. And I know that having a low milk supply, whether pumping or breastfeeding, is a massive concern as a new mum, as there's such a huge amount of pressure on you to feed your baby. I designed a free resource for you called 10 Ways to Make Your Breastfeeding Journey Easier, because I know in those early days we all need a little bit of extra support. Find a link in the description below. In this video, we'll look at why milk supply can dip, what you can do about it, and if you stay till the end, I'll tell you exactly when you need to seek professional help. Whether you're a new mum or on your second, third, fourth baby, this video is for you. So what exactly do we mean by low milk supply? Basically, it's when a mum isn't producing enough milk to meet her baby's nutritional needs. But many mums worry about low supply when they're actually making plenty. There's a term for this. It's called perceived insufficient milk, or PIM for short. It's incredibly common, and it's one of the main reasons mums stop breastfeeding earlier than they planned. Basically, it means that a mum might believe she has a low supply when actually she doesn't. There are loads of reasons she might think this, and we haven't got time to go into detail today. But the key to knowing if you really do have a low supply is to look at your baby, not your breasts. If your little one is gaining weight well, having plenty of wet and dirty nappies, and seems content after most feeds, chances are you're producing enough milk. Check out my video here where I go into more details about this. You can reach out to trained professionals for personalised guidance, like your doctor or lactation consultant. They can help you determine if you're dealing with PIM or if there's an actual supply issue that needs addressing. Remember, your body is designed to feed your baby. More often than not, you're making exactly what your little one needs. But if there's an issue, there's usually something we could do about it. Now we've cleared up the difference between perceived and actual low milk supply, let's find out why some mums might genuinely struggle with their milk production. There's quite a long list of reasons, but to make it easier to understand, I've grouped them into 4 main categories: physical factors, lifestyle factors, medical conditions, and external factors. We'll go through each of these categories and I'll give you some practical tips on what you can do to help boost your supply along the way. I'm not going to list every single tiny possible reason that your milk supply can be low, because there are some medications, medical conditions that can cause a low milk supply. But in this video, we'll cover the main ones that will probably be affecting your milk supply if you do have a low supply. Before I get started on all the reasons, I want to highlight one crucial point. The number one cause of low milk supply is simply not emptying the breast often enough. Whether breastfeeding or pumping, your body works on a supply and demand basis. The more milk that's removed, the more your body will make. So frequent and effective milk removal is key to maintaining and increasing your supply. Now, with that in mind, let's look at the various factors that can affect your milk supply. Let's start with physical factors. These are things to do with your body that you might be able to address yourself. A crucial one is breast pressure. Here's something interesting. Increased pressure on your milk-making cells, called alveolar cells, can actually cause less milk to be made. When there's pressure, these cells change shape, so less milk can fit inside them. Think of your alveolar cells like a balloon. If you press on the balloon, you can't fill it up with as much air. Give it space and it can keep expanding. Pressure can happen in a few ways. The first is when milk is left in the breast after a breastfeed. This also applies to pumping. Sometimes second-hand pumps aren't as effective at milk extraction, so it might be worth investing in a new one if you notice a dip in supply. Another reason is if you miss feeds and become engorged, as engorgement puts pressure on the breast tissue. Wearing restrictive bras and clothing can compress your breast tissue too. For mums with breast implants, the implants themselves can take up space in the breast. So what can you do? Try to ensure your breasts are well drained after feeds. If your baby doesn't empty the breast, you might want to pump a bit afterwards. Feed your baby on demand to avoid engorgement, and wear comfortable, supportive bras that don't squish your breasts. It's all about reducing that pressure on your milk-making cells to help them do their job efficiently. Another crucial physical factor is your baby's latch. A poor latch means your little one isn't removing milk efficiently, which can lead to decreased milk supply. If you're struggling with latch, don't suffer in silence. Seek help from a lactation consultant or check out my video on achieving the perfect latch. Last in this category is breast surgeries or trauma. This includes breast reductions, augmentations, biopsies, or other procedures. These surgeries can potentially affect milk production if milk ducts or nerves were damaged during the procedure. Saying that, it's important to note that many women who've had breast surgeries can still breastfeed successfully. If you've had breast surgery and are concerned about your milk supply, consider working with a lactation consultant who can help you maximise your milk production. Also, talk to your surgeon about the specifics of your surgery in relation to your breastfeeding ability. There's much more to say about breastfeeding after breast surgery. Let me know in the comments below if you would like me to do a video on this so I can go into more detail. There are a few lifestyle factors such as daily habits and lifestyle choices that can affect your milk supply too. Nutrition and hydration are big ones. Not getting enough calories or fluids can directly lead to a decrease in milk supply. Here's why. Your body needs energy and nutrients to produce milk. Breastfeeding typically burns an extra 300 to 500 calories a day. Check out my video here for more about calories and breastfeeding. If you're not consuming enough calories, your body might reduce milk production to conserve energy for essential functions. It's like your body's way of saying, we don't have enough fuel for everything, so we need to cut back. The type of calories matters too. A balanced diet rich in proteins, healthy fats, and complex carbohydrates provides the building blocks for milk production. Lacking certain nutrients can affect the quality and quantity of your milk. As for hydration, breast milk is about 90% water. If you become significantly dehydrated, your body might reduce milk production to maintain its own hydration levels. This is why you might feel extra thirsty when breastfeeding. Aim to eat a varied diet and drink to thirst, which is usually around 8 to 10 glasses of water a day. You don't need to count every calorie or obsess over every sip, but being mindful of your intake can help support a healthy milk supply. Stress is another significant factor. When you're stressed, your body produces cortisol and adrenaline, which can interfere with oxytocin, the hormone responsible for your letdown reflex. This can make it harder for your milk to flow, with chronic stress potentially leading to a decrease in supply over time. While the hormone prolactin can help counteract some of the effects of stress, it's best to try to incorporate stress reduction techniques like deep breathing, mindfulness, or gentle exercise into your routine. Alcohol consumption is another factor to consider. While an occasional drink is usually fine, regular or heavy drinking can interfere with your letdown reflex and potentially decrease your milk supply. Alcohol can also change the taste of your milk, which might lead to your baby nursing less, indirectly affecting your supply. Have a look at my breastfeeding alcohol calculator on my website from bumptobubble.com for some guidance here. I'll pop a link in the description. Smoking is a significant lifestyle factor. Not only can it decrease your milk supply, but it also changes the composition of your milk and can be harmful to your baby. If you're struggling to quit, talk to your healthcare provider about safe methods to reduce or stop smoking while breastfeeding. Timing is crucial too. Initiating breastfeeding early, ideally within the first hour after birth, otherwise known as the golden hour, can help establish a good milk supply. If you wait too long to start removing milk, whether through breastfeeding or pumping, it can be harder to build up your supply later. Supplementing with formula is a tricky one. While sometimes necessary, it's important to understand that every time you replace a feed with formula, you're telling your body to produce less milk. If you need to supplement, consider pumping at the same time to maintain your supply. Feeding schedules can also impact your supply. Your body works on a supply and demand basis, like we've said before. Scheduling feedings, especially if they're spaced far apart, can signal to your body to produce less milk. Try feeding on demand instead, responding to your baby's hunger cues rather than the clock. Dummy or pacifier use is another factor to consider. While dummies can be helpful, overuse, especially in the early weeks, can mean missed feeding cues and potentially less frequent breast stimulation, so try to use them judiciously. Some sleep training methods involve reducing night feeds, which can impact your supply. The hormone prolactin, which is crucial for milk production, tends to be higher at night, so those night feeds, while tiring, can be important for maintaining your supply. There are a few medical conditions that can affect your milk supply. The general advice for all of these is to contact your doctor if you suspect any of these issues for proper diagnosis and treatment, and make an appointment with a lactation consultant. They can help you maximise your milk production within the constraints of your medical condition. Hormonal imbalances can play a significant role in milk production. Conditions like polycystic ovary syndrome, PCOS, Thyroid disorders, both hyper and hypothyroidism, and diabetes can all interfere with hormonal balance necessary for optimal milk production. These conditions can affect hormones prolactin and oxytocin, which are crucial for milk production and letdown. Retained placental fragments are another potential issue. If small pieces of the placenta remain in the uterus after birth, it can lead to elevated progesterone levels. This is important because the shift from colostrum to mature milk is triggered by a drop in progesterone. So if that drop doesn't occur because you've got retained placenta, it can delay or hinder the establishment of full milk supply. Some women may have insufficient glandular tissue, known as hypoplastic breasts. This is a rare condition where breasts lack enough milk-producing tissue. It's often characterized by widely spaced breasts with prominent areolas. Postpartum hemorrhage can also impact milk supply. Severe blood loss during or after delivery can potentially damage the pituitary gland, which is responsible for producing prolactin, the primary milk-making hormone. Check your birth notes if you suspect this happened during the birth of your baby. If you've undergone IVF, you might face some unique challenges. While IVF itself doesn't cause low milk supply, the associated health conditions, stress, and potential birth complications can contribute to difficulties in establishing a good supply. Having a medical condition doesn't necessarily mean you can't breastfeed successfully. With proper support and management, many women with these conditions go on to have positive breastfeeding experiences. Some external factors can affect your milk supply too. These are often things you might not immediately think of, but they can have a significant impact. First up, medications. Some medications can potentially decrease milk production. Birth control pills containing estrogen are a common culprit. The estrogen can interfere with prolactin, the hormone responsible for milk production. If you're breastfeeding and need contraception, talk to your doctor about progesterone-only options, which are generally considered safe for milk supply. Cold and allergy medicines can also be problematic, especially those containing decongestants. These work by drying up secretions in your body, including potentially your milk. Even a single dose can affect some women's supply, but not everybody, so don't panic just yet. If you need cold relief, consider alternatives like saline nasal sprays or speak to your healthcare provider about breastfeeding safe options. If you become pregnant while breastfeeding, you might notice a decrease in your milk production, especially in the second trimester. This is due to hormonal changes associated with pregnancy. Saying that, I breastfed my first baby right up until I was 7 months pregnant with my second, with no problems at all, so it doesn't affect all women. The return of your menstrual cycle after giving birth can also temporarily affect your milk supply. Some women notice a dip in supply just before or during their period. This is typically due to hormonal fluctuations and usually resolves once your period ends. Many of these external factors are temporary and can be managed with the right support and strategies. Now that we've covered the reasons why you might have low milk supply, you're probably wondering what you can do about it. I've got you covered. I've made a detailed video all about how to boost your milk supply. You can see a card popping up on your screen now. It's packed with practical tips and strategies to help increase your milk production. Many causes of low milk supply can be tackled by you alone, but there are some circumstances when I would urge you to seek professional help. These include if your baby isn't gaining weight or having enough wet, dirty nappies, if you're experiencing consistent pain during feeding, if you've tried increasing your supply for a week or two without improvement, if you have a medical condition that might be affecting breastfeeding, if you're feeling overwhelmed or anxious about feeding. Remember, lactation consultants, midwives, doctors, breastfeeding support groups are there to help you. Don't hesitate to reach out. Getting help early can make the world of difference. If you found this information helpful, please give this video a thumbs up and hit that subscribe button to stay updated with more breastfeeding and parenting tips. I've got a video planned to help you know if your baby is getting enough milk, so turn on notifications. And don't forget to grab your free resource in the description below, 10 ways to make breastfeeding easier.